What are the structures of the respiratory system?
The respiratory system is a complex network of structures that work together to bring air into the body, facilitate vital gas exchange, and remove carbon dioxide. It is commonly divided into the upper respiratory tract and the lower respiratory tract. Let's first talk about the upper respiratory tract. The nose and nasal cavity serve as the primary entry point for air. They filter, warm, and moisten incoming air, protecting the delicate lower airways. Nasal congestion or obstruction, such as from allergies, a deviated septum, or polyps, can significantly affect breathing and comfort. Assessment of nasal airflow is often a part of a routine exam, especially if a person has chronic stuffiness or snoring. Sinuses are air-filled spaces within the skull that connect to the nasal cavity, helping to condition inhaled air and lighten the weight of the skull. Sinus infections, called sinusitis, cause pain, pressure, and headaches, and are a frequent reason for patient visits. The pharynx or throat is a muscular tube that serves as a common pathway for both air from the nasal cavity to the larynx and food from the mouth to the esophagus. Inflammation here, known as pharyngitis, is a typical cause of sore throat. Swallowing difficulties and risk of airway obstruction are assessed here, especially in infections or trauma. Now let's look at the lower respiratory tract, which begins with the larynx or voice box. This is located just below the pharynx and contains the vocal cords for speech and acts as a critical airway protector by closing during swallowing, preventing aspiration. Hoarseness, voice changes, or airway obstruction, such as from laryngeal edema or trauma, can signal serious problems. The larynx is also the target for airway management during intubation. The trachea or windpipe is a rigid tube supported by C-shaped cartilage rings and keeps the airway open as it conducts air toward the lungs. Trachea's rigidity is vital for airway patency. Clinical issues include tracheal deviation or blockage, and it's a common site for emergency procedures like tracheostomy or intubation. The trachea divides into right and left main bronchi, which enter the lungs and branch repeatedly into smaller bronchi and bronchioles. These tubes are the primary airways within the lungs. Diseases such as asthma and bronchitis cause narrowing and inflammation of these passages, leading to wheezing, cough, and difficulty breathing. Many medications, like inhalers, specifically target these airways. Alveoli are tiny, grape-like air sacs that are the primary sites of gas exchange, where oxygen moves into the blood and carbon dioxide is removed. Their thin, delicate structure makes them susceptible to damage from pneumonia, emphysema, or acute respiratory distress syndrome, all of which severely impair oxygenation. Auscultation for crackles or diminished breath sounds helps clinicians detect alveolar involvement in disease. Now let's turn to some other vital structures involved in respiration. The diaphragm is a dome-shaped muscle beneath the lungs, and the intercostal muscles lie between the ribs. Together, they contract and relax to change the volume of the chest cavity and drive ventilation. In respiratory distress, increased effort or use of accessory muscles, such as the neck muscles, may be visible, an important clinical sign observed during patient assessment.